The next speaker is Dr. Pooja Hingorani.
I'll also need the pointer.
AV team.
Pointer is there.
Yeah. So, good morning, everyone. This was a very interesting. We noted certain things that we were designated as the NEET PWD, or Patients with Disabilities Verification Center. To begin with, patients with disabilities, not just physical and intellectual as we think, but also mental and sensory. And anything above 40% is a benchmark disability when it comes to classifying NEET students as a PWD criteria. So when students are about to give the NEET exam, they are supposed to register as PWD by a certificate, disability certificate given at the district level. But after giving the exam and getting the result, they are supposed to verify that disability with 16 centers, out of which one is ours, all over India. So what we noticed was, so this is the way we classify. Two things in this which I want you to see is, anything 30% is one-eyed, and it is under the PWD criteria. It does not satisfy the PWD criteria. The category 3, 40 to 80% is PWD criteria. Above 80% is blindness. So again, it's not visual impairment. So students cannot apply for MBBS. So based on this, we wanted to see how much was the difference in disability percentages from the primary center to the tertiary center. That means the first certificate to the second certificate. And the ratio of students who applied to us, how many of them were really eligible to apply for MBBS. The secondary was how many of these students were malingering and what was the reasons for this. So it was a retrospective hospital record-based study. We were a center since 4 years, and the NEET students were the ones included, consecutive sampling amounting to 154 students. So the only ones we excluded were the ones with multiple disabilities, because there's a separate formula for those. So this was again we classified the data, and guess what? This is our result. The average rank, open rank, is 5.22 lakhs, which comes down to 1300, a dramatic 400 times change in an asking percentage. So this is the reason. Now what we saw that among, just one sec. So 98% of the students would have been eligible had it been only through the primary center, but actually they were only 29% from our center. These were the students who were eligible above 40%, less than 80%. And amongst those who were classified as less than 40% by the primary center, we almost agreed with all. But amongst those who had 40%, we disagreed with 91%. They were less than what were given by the primary center. Amongst them, 0% was in 27%, and 30%, that means one-eyed, was in 44%. Similarly, to those who were given more than 40% by the primary center, we disagreed with a huge amount, out of which again 0% was, and 30% were significant. So this was the agreement statistics. On an average, our percentage was 24% less than the center. The mode was 0%. Most of the students had 0% disability out of the 154. Median was 30%. So we realized that the students having 0% disability were the ones we classified as malingering, with 30% of the total. And 75% had some sort of exaggeration. They had 10% disability but came as 40, or they had 20 and came as 40, etc. So why is this happening in primary centers? Maybe lack of index of suspicion, lack of sophisticated equipment to rule out malingering, non-availability of visual field testing at their centers, inadequate, the last two slides. Inadequate training, or is it sympathetic attitude towards the local students? And why is this trend? Because this stress on bacha doctor banega, a difference in acting asking percentage, and this is 4 days ago. Times of India has reported 20 lakh students have applied for NEET this year versus 3 lakhs, 0.7 lakhs in 2015. So we would suggest this triangle or base approach. We repeat vision, we randomize, we counsel the students. Second level, we do visual fields, and third level, we do VEPs also. So one thing we have to be very watchful against is the diagnosis of amblyopia. So in conclusion, 18% only showed agreement, 29% only of the students were actually eligible. Out of these, many were one-eyed, and 30% had no disability at all. Among the 70% with some disability, most of them had an exaggerated score. Of these, 94% was not eligible. So the role of an ophthalmologist, primary center training, beware of the diagnosis of amblyopia, using HFA, suspicion of one-eyed patients, and this is something that we have faced. We have been threatened by relatives, and so what we follow is parents outside, guard inside, and students counseling. Thank you so much.
Wow, very nice, ma'am. This is one of
This is
its
never
kind
done.
of a study.
This has never been done, and this is actually the social situation of India right now.
But why do the students malinger?
Ma'am, 400 change in rank from 5 lakhs to 1300. So they literally fight with us, and they come and they fight and they say, oh, you're spoiling my child's 1 year or 2 years of study. You have to consider this. And we've had, relatives, in the goons in the form of relatives, ye mama hai, ye chacha hai, come into our clinics and actually tell us, oh, you're spoiling my child. Some children even threaten us that we'll commit suicide. And these are MBBS students, and it's a very difficult thing, and nothing has been done about.
Actually, it is a huge issue. But you have rightly pointed out, primary health care should have a proper distance vision chart. They should know malingering. For what purpose is applying for? Is there a secondary gain also? And as rightly pointed out, a visual field is obviously not available. So probably they will refer to some higher center get visual field check before giving any certificate to patients.
Maybe there should be policy issues if there's such a big difference in percentage also, because now they're not scared of giving 40%. And if they are pointed out, and if there's a policy change at the government that the actual percentage is 0 and they're giving 40 and some action is taken, maybe even that might help. I'm not sure about this. Thank you so much.
Thank you. The last